must be my cranial nerve exam appointment. Yep. Yep. Is this your first cranial nerve exam? Okay. Pretty much it's just a series of tests to make sure everything is working properly. I will be testing your sight, your taste, your ears. It's just a variety of tests, and it takes about a half hour to 45 minutes, somewhere in there. So, is that what you're here for? Okay, good. Well, I'm just going to start by asking you a few questions. First off, what's your name? Okay. And how old are you? And I know that you said that this is your first one, so I guess I don't need to ask you when your last one was. Alright. Any medications you are currently on, just as a precaution? Okay. No, that drug, that should not affect anything we're doing here. It's just, I'm required to ask a question like that. Okay. Do you have any sensitivity to high-pitched noises or low-pitched noises? No? Okay. And what about light? No sensitivity to high light? No? Okay. Alright. So, that's pretty much all we have to do for questions. That's all we really need to know for this test. So, the first thing we usually start with is smells. So, what I'm going to do is I'm going to take a piece of fabric that has been drenched in some kind of fragrance, and you just have to tell me which fragrance you think it is. So I'm going to be doing this 3 times with 3 different fragrances, and we'll see if we can get them all. Alright, so I'm going to hold this up to your nose, and just tell me what you smell. Yep, that's mint. Good job. Okay. That's a good start. Let me grab the next one. And now just tell me what you smell. Yep, cherry. Good job. And now, this is our most difficult one, but there should be no problem recognizing what it is. Alright, just one more time. Tell me what you smell. Yep. Now, can you tell me what kind of soap? No, I'm just kidding. You just have to tell me it was soap. Alright. So, your nose seems to be smelling everything the way it should be smelling stuff. So, we're going to move on to the next step. And the next step is, what do we want to do next? Let's do this. what I'm going to do here is show you a page full of words, and I just need you to tell me or read me the word that I am pointing at in this page. Okay? Alright. What does this word say? Good job. Alright. Can you tell me what this one says? Good. And what about this one? Very good. Alright, let's see if we can give you a hard one. What does that four-letter word say? What is that four-letter word? Good job. Alright, so you seem to have no problem reading, and your eyesight with reading seems very good. You obviously told me all the words correctly. So, next thing we're going to do is I'm going to put on a pair of gloves, and you are going to tell me, which hand is moving. I'll show you what I mean in just a second. Just let me get these gloves on. So, in this step, what I need you to do is I'm going to have both my hands out in front of me. And when you see one of my hands moving, I would like you to tell me that you see my hand moving and point at which one it is. Okay? Good. Very good. There you go. Good. Yep, both is an answer. Yep. Good. Just a couple more. Yep. Very good. Good. Okay. So you had no problem with that test. Now I'm going to do a very similar thing, except this time you're going to tell me when my hand is moving, not which one, because I'm going to cover each eye, and with the other hand I'm going to move it, and you're going to tell me when it moves, okay? Alright, here we go. Good. times I open and close my hand in each sequence. Yep, once. Of course, 4 times. Alright, now I'm going to do the same thing with your other eye. Yep, 3 times. So, as far as I can tell, your eyes are working as well as they can, and you can count to 3 or 4. So, there's no problems there. Now, this is where I'm going to take a light. This light. And I'm going to shine it into your eyes. And you're gonna, well, you're not gonna do anything. You're gonna sit there and look at the light. And I'm going to make sure that your eyes are contracting properly or dilating properly. Okay, you ready? That one looks good. Yep, that one looks good. Let me just test one more time. Yep, everything looks good with that one. Okay, so both of your eyes dilated properly. Now, I'm going to shine the light in your eyes again, except this time, your goal is to follow the light with your eyes. Try to keep very smooth movements with your eyes. Try not to jitter them, if you know what I mean. Just nice, smooth movements. Please. We're going to make sure that your eyes are tracking properly. Okay, here we go. So, your eyes seem to be tracking properly. Now, for a third time, I'm going to shine the light in your eyes, but this time, I'm not trying to test dilation of your pupils. I'm going to be looking deeper into your eyes, so I'm going to have to get up very close, if that's okay with you. Okay. I'm just going to look for any abnormal behavior in the eye when a light hits it. Okay. Oh yes, everything looks very good right now. Yep, there's nothing abnormal about your eyes. Everything looks very good. Alright, yep, this one, besides a little bit of a bloodshot eye, there's nothing of concern in this eye. So, with that said, your eyes are fine. Your nose is working properly, your eyes are working properly. Now we're going to move on to your ears. Now, you did tell me that you don't have any sensitivity to hearing loud or low frequencies. What about high frequencies? Okay, so there's nothing to be worried about there then. First thing I'm going to do is I'm going to clean your ears a little bit. Sometimes wax inhibits the ability to get a good result of a test like this, so I'm just going to do a little cleaning inside your ear just to make sure they're in tip-top form, ready to do this test. Okay, just sit very still. I don't want to poke anything in your ear that I shouldn't be poking. It might tickle a little bit. Okay, now the other ear. Now your eardrums are free of any obstruction, and I will commence the next part of the test. So, in this part, I'm going to be squeezing my hands again, except this time you're not looking at my hands, you're listening for my hands. I want you to tell me if you hear the noise in your left ear, your right ear, or both ears. Okay? Here we go. Good. Very good. Yep. Okay. Yep, one more. Okay. So far you're acing this test, as you should. If everything's working properly, there's no reason you shouldn't get everything right on this test. Now, I'm going to move my hands in a direction, and I just need you to tell me which direction my hand moves and when you can no longer see my hand. Okay. So when you can no longer see my hand, tell me to stop, and then I'll ask you what direction the hand moved. Okay, what direction was it going? Yep, okay. And the direction? Yep. And what way was it going? Yep. And one more. And what way one more time? Good job. Now, I'm I'm going to, we have these little tablets here. These are very new. These tablets are full of a flavor, and this flavor is going to be very strong, and it's either going to be sour or bitter. Now, although bitter might be nasty, we have to do this test to make sure all your taste buds are functioning properly, and make sure that your brain is registering taste the right way. So, here's the first tablet. Okay, open wide. Okay. Now, was it bitter or sour? Sour? Okay. Like a lemon? Yes, of course. And we only have one more tablet. You might dodge a bullet and not get bitter this time. Open wide. And what was that one? Sour too? Alright, good job. So, you dodged a bullet, you didn't get bitter. Normally the patients that get the bitter ones are not too thrilled. And we only have one more part of the test. And this is also a test where I have to get very close to you. Is that okay again? I'm going to be whispering a series of 3 numbers into your ears. You need to repeat back the numbers that I say to you. Okay. 3, 28, 7. Yep. 28, 9, 900. Okay, good. 6, 6, 17. Yeah, very good. If the traffic is too noisy for you, I apologize, and we'll redo the test if you feel that the traffic has flawed the results. I'm very, truly sorry about that. Okay, one more time. 4, 55, 762. Alright, very good. So, that was the last portion of the test, and you did as well as possible, and that's very good considering the noise levels around today. It's a very busy day. So for your follow-up, I'll go over your results now. Okay, so the first quarter, you got 100. Second, 100. Third, 100. And fourth, 100. You can't get much better than that, so I don't really have to say many things to you besides whatever you're doing, keep doing it. You seem very healthy. Your eyes, ears, mouth, your nose too. It all seems as healthy as it can be, and I don't have to prescribe you anything or give you any suggestions. I'll just tell you, just keep up whatever you're doing because it seems to be working very well. Okay, so if you don't have any further questions, that will bring an end to this exam. No questions? Alright, thank you very much for stopping in today, and I'll see you back here in exactly 1 year. I'll have the secretary write it up for you on your way Thank you. Goodbye. Hello? How are you today? Good. That's very good. So, have you ever been here before? No? Okay. So, do you know what we do here? No? Okay. I can give you a little bit of a rundown. Pretty much, I'm a special kind of doctor. There's none like me really anywhere. What I do is one thing and one thing only. Try to relax you by pulling out your stress. Most people think that stress is just a mental thing and there's no way to get rid of it physically. Well, I'm living proof, and my career is none other than to pluck all of the stress out of you. So, pretty much what I do is think of it as a haircut, except instead of taking hair off of you, I'm taking stress off of you. Does that sound like what you're here for? I know that the pamphlet you must have gotten in the mail was very vague, to say the least, and you really didn't know what you were in for. But if you're here for relaxation, that's what we do. Alright, so I guess if there's no other questions, we can get started. No other questions? Well, we don't have to ask you as many questions as a normal clinic because, quite frankly, this isn't a normal clinic. I'm not going to prescribe you any drugs. I'm not going to really even do things that normal doctors do. I'm just going to simply use my new techniques to relieve you of stress. And I can see right now you have a lot of it, so I'm going to do my best to get as much of it gone as possible. So what I like to start by doing is just kind of observing your stress levels and kind of getting a gauge on how fast stress is popping up and how thick the stress is. Yeah, you have quite a bit of... Yeah, it's definitely getting up there, so first thing I like to do is just kind of grab big balls of it at first, just to get a majority off of you. So, yeah. So what I'm doing, I'm just pulling the stress off of you. Just making sure that none of it stays on you. And by the end of your visit, 100% of your body will be stress-free. There's a big chunk right there. Sure, I get all the big chunks. Oh yes, I almost forgot. Just one second. I like to show a before shot of your stress and an after shot to just show you that this method is very effective in relaxation. So this is a before shot, okay? Look at you, all stressed out. You look like a normal human to me. But let's continue pulling out the big balls of stress. You should feel way, way better after this. Okay. All the big chunks are almost gone. Okay, so now I'm just gonna go get up really close and get the smaller chunks. It's growing pretty fast, so just gotta make sure I get all of them. Okay, yes. Actually, they're coming up really fast here. Let me just go quickly and get all of them. Popping up everywhere, all over your face, all over your hair. Just so much stress, but it's leaving your body. That's all that matters. Okay, let me just get these things off you, yes. I think we're doing a pretty good job. Do you feel any more relaxed yet, or should I keep going? You feel a lot more relaxed? That's good. Well, let's just continue and make sure you leave here absolutely as relaxed as possible. There's a couple really close ones here. Okay. Man, you must have had a really tough work week or something. You might have the new record for the most stress on one person. Alrighty. So, what I like to do now is use a finer instrument to make sure that I'm getting every last little bit of stress off of you. So, I'm gonna get up close, just pull these little guys out. or not, I think we're almost done. What's that? I have a little bit of stress on my own face. Oh. Where is it? It's like right here? Oh, a little bit over? Okay. I get it? Good, good. I can't have the stress doctor having stress of his own, right? Just about one more minute of this, I'd say, and then we can move on to the next and actually final step. That looks pretty good. So the last step is pretty much like after a haircut, you have all those tiny hairs laying all over you. So same with stress. All the stress I just pulled off of you could be laying on your face still. So what we're going to do is take one of these large brushes and just brush your face with it. Just make sure all of the stress is off of you. Okay. I'm not tickling you, am I? No? Okay, good. Okay, just a little bit more. I see some strays laying around here. Alright, so the final step is just to show you how you look now. And to the untrained eye, you're going to look the exact same, but to me, you look completely different. So, here's the new you. Yeah. You still look completely normal to me. Yeah, you did kind of look like a camera a little bit, but I can assure you, you look perfectly fine to me. So, next time you have too much stress, you need a stress ball out, come here. Thank you. Hello. Are you here for your cranial nerve exam today?
Yes.
Okay, have you ever been here before?
No.
Then I'm just going to start by asking you a few questions. First off, what's your name?
Cranial.
And how old are you, Danielle?
22.
And you said this was your first cranial nerve exam? Okay. When's the last time you saw your normal doctor for a regular checkup?
Probably like 2 months ago.
2 months ago, okay. And everything was normal? Okay. Alright, so cranial nerve exam is just a series of tests, obviously to test your cranial nerve area, just to make sure everything's working properly. It's not very intrusive, but it could take a half hour or so. Is that okay? Alright, so let's get started. We'll start off by testing some of your eye functions. First thing I'm going to have you do is I'm going to put my fingers up like so, and I'm just going to move them around, and you just have to follow my fingers, okay? So just, well, one at a time. Just watch my finger. Very good. Now this one. Good. Good. And one more time. Very good. Okay, so your eyes were tracking properly. So next on the list, I'm just going to flash this light into your eyes and make sure your pupils are dilating properly. So it might be a little bright at first, but just relax. Yeah, it's a little bright. A couple more times. You don't have to look directly into it if you don't want. Very good. Now I'm going to have you do the same thing that I did with my fingers, except with the light. So I'm just going to have you track pretty much the end of this pen light, please, with your eyes. Now I'm just going to do a routine checkup on your scalp. So just stay very comfortable. I'm not going to hurt you. Well, you would hope your doctor's not going to hurt you. Sorry if I'm messing your hair up. looks very normal. Now, this one is to test your hearing. What I'm going to do is I'm going to hold my hand up to each one of your ears, and I'm just going to make a slight sound with one of the ears. I'm going to have you close your eyes for this test, and you're going to point to which ear you hear the sound in, okay? All right. Yeah. Very good. Excellent. Good. Yeah, I tried to catch you off guard, but you can open your eyes now. Okay. Now I'm going to check pretty much the roots of your hair and make sure everything is healthy in your hair. Have you recently had your hair dyed? Yes? Okay. Sometimes that could have some harmful effects on the hair, so I'm just going to make sure everything is growing properly still. Would you like to take a break after this, or are you good to go? Yes? Okay. Just shut the other side, and then you can have that break. The dye doesn't seem to have affected your hair. It's looks very healthy to me. So you want to take a break? Okay. Alright, so where were we? Okay, I just checked your hair and everything looked good. Now what I'm going to do is take some tweezers and just get some hair samples from you. Slight little pinches, but nothing too bad. Just stay very still. Little pinch. Another little pinch. Just a few more. 3, 2, 1. And I'm going to grab a couple from the other side. 3, 2, 1. And one more. 3, 2, 1. Alright. Now I'm just going to touch your face a little bit and feel out your pressure points, make sure nothing hurts, okay? Just look right at me. Some people think these cranial nerve exams are really relaxing. I can tell you think that. You're not feeling any pain anywhere in your face? No? And can you turn your head all the way to the right? Yeah, you're right. You got it. I didn't specify my right or your right. Okay, and the other side, please. Alright. If you're not feeling any pain, then I think everything is good here. Alright. Now I'm just going to outline your face with a bunch of different brushes and see how your skin reacts to certain brushes. Make sure it doesn't have any unnecessary twitches, if you know what I mean. Sorry if it tickles. One more with the finer brush. So, as far as I could tell, your face doesn't have any unnecessary twitching, so that's good. All your nerves in your face seem to be firing just fine. This is essentially the same test. It's just with a little bit more pressure instead of a brush. I'm going to use my fingers, okay? I'm just going to tap around your face. You okay? No pain anywhere? Good. Okay. And now I'm just going to have you look up at the ceiling and I'm going to check your nose. Make sure they're not inflamed. Make sure everything's where it's supposed to be. This doesn't hurt, right? Same on that side, no pain? Okay, everything seems to be fine there too. So far, so good. Nothing seems to be of any concern. Now, in this test, I'm going to hold up a couple of different sticky notes, and I need you to tell me if they're the same color or different, okay? So, here's your first two. Different. And what color is this?
Yellow.
And this one?
Green.
Very good. And what about these two?
Yellow. Blue.
Okay.
They're the same.
And they're both
Pink.
okay. Alright, I'll do one more. This is the most common colorblind.
They're different.
And
Pink. Green.
very good. So we don't have to worry about your color blindness. You can see colors just fine. Now I'm just going to check your ears with my light. Make sure there's no redness or swelling. Thank you. So far, so good. I like these earrings. Make very cool jingle sounds. You have a nice rocket ship earring too. Oh, that's a planet, not a rocket ship. Sorry, maybe I need a cranial nerve exam. Everything looked good with your ears too. We only have 2 more tests to do. And then I'll send you on your way because everything's looking very, very good. Now, for this one, I have this cotton ball. I'm just going to spray it with some kind of fragrance, and I'm going to hold it under your nose, and you're going to tell me what the fragrances are. Okay. So. Citrus, yep, very good. And here's the second one.
Vanilla.
Yep, very good. And last but not least,
It's almost like a rubbing alcohol.
yep. So, your nose is definitely smelling everything the way it should be smelling things. And last but not least, of course, your taste. I'm going to do the same thing, but instead of fragrances, there's going to be a little bit of residue on the cotton ball. Just going to dab it with your tongue and then tell me what it tastes like, okay?
It also tastes like citrus.
Citrus, okay. There's 2 more.
Honey.
Honey, yep, very good. You're about to ace this cranial nerve exam if you can tell me this last thing.
Grape.
Well, I'm sorry to tell you, but after all that, I'm just kidding, you passed. So, everything looked good with your eyes, your ears, no pain anywhere, anything you want to talk to me about, or anything that needs to be brought up to a doctor?
Not that I can think of.
Well, are you lying? Alright, so that concludes this cranial nerve exam. I would like to see you back here 1 year from now. Same thing, same situation, and hopefully it goes as well as this one did. Thank you very much.
Thank you.
Have a good day. You're back again. What could possibly be wrong with you this time? I know I didn't schedule you for another cranial nerve exam, so you must have something wrong with you today. Oh, you're feeling a little under the weather? Well, I'm very sorry to hear that. How so? Like flu-like? Or you just sore? Flu-like? Okay, so you're very tired. Yeah, I can tell you look a little flush, and you have bags. It does look like you are very tired. And what about your body? Is it excessively sore, or how's that? Feels pretty sore? Okay. Yeah. So what I'm gonna do is just a routine checkup on you, pretty much, and we'll see if everything's alright, or we'll see if you need some kind of antibiotics of some sort, okay? This is not like a cranial nerve exam. I won't be doing all the same things. I know you know all about them by now, but we'll do some different things to you today. But for right now, let's hope by the end of this, we can check this box. Healthy. Alright, so how do we want to start? I can get out my stethoscope here and check your heart. This is obviously a very high-tech, very real stethoscope. And it's definitely not a playset stethoscope. It's real. So I'm just gonna come in close. I'm gonna listen to your heart. Okay. All right. Take one deep breath. Okay. Again. All right. And one more deep breath. Very good. All right. I'm gonna come around to the other side and place it on your back now. Alright, one more time. And just give me one more good deep breath. Alright, very good. So your heart seems to be beating perfectly fine. So that's obviously a good sign. Okay. So next what I'm going to do is I'm just going to use these little scissors and little tweezers to take some hair samples. We're testing out a new way to test for flu, like symptoms and stuff like that, but I'm still going to have to take your blood, unfortunately, just to test that as well, because that's the surefire way. But for right now, I'm just going to come up and take a couple pieces of hair. So, I know it seemed like I just cut half of your head of hair off, but I only took about 4 or 5 pieces, so don't worry. You still look the same, trust me. But, oh, I almost forgot. Should probably put my gloves on. I mean, this is a doctor's office after all. there's actually a new policy going around saying that we have to sterilize the gloves as well. I don't really know why, but just give me a second to make sure I get all the germs off the gloves for you. I don't know why this is a new policy, but they just implemented it, so let's see. I guess it's better safe than sorry in this case, so. Alright. So, next thing we're going to do is you want to do the hard stuff first, or you want to wait until later? I'm only asking because at some point I do have to take your blood, and a lot of people don't like that part, obviously. You want to get that right out of the way? Sure thing. So, obviously, it's a very dangerous needle. And, see, it's even shows you the danger. It's got a heart on the top of it. But, I'm just gonna stick this in your arm, and please don't yell too loud, or we don't need another incident like last time. No, I'm just kidding. I've never hurt anybody in here. Just let me see your arm. Alright, 3, 2, 1. Alright, see? That was easy, wasn't it? It did not hurt that bad. Grow up. Alrighty. Obviously, one of the more important things that we're going to have to do is take your temperature. Now, I know this doesn't look like a normal thermometer to you, but it is. Most people, when they see this, they think that I'm not going to put it under their tongue. I'm going to put it somewhere else. I don't know where else I would put something that looks like this to take your temperature. Oh, I think I understand now. No, that's not what kind of doctor's office this is. We're just going to take your temperature under your tongue. We'll just stick with that on this one. Just open your mouth very wide for me. Stick this under your tongue. And now we sit here for about 30 seconds. So you read any good books lately? Oh yeah, you can't talk. You've got something in your mouth. Gotcha. You think it's been 30 seconds yet? Alright, we'll take it out. Holy moly. Well, your temperature is definitely concerning to me. And maybe I should stop taking this visit as a joke, because if you can see right there, maybe you can't, but you're at 104 degrees Fahrenheit. That's definitely a cause for concern, and let's see how the rest of the tests go. Alright, so now what I'm going to do with this very high-tech device is look deep into your retinas and make sure everything looks good in your eyes. The only reason we do this is when the temperature on somebody is higher, we like to make sure that we can rule out anything above a flu, and a lot of things that are above a flu would cause some kind of deterioration in the eye sockets. So I'm just going to get up close and I'm going to look through this. Alright, that eye looks pretty good. Well, let me see here. Yeah, that eye looks pretty good. Now let me look at this one. Yeah, this eye seems to be a little bit more bloodshot than the other eye, but we can chalk that up to playing too many video games. Not really anything concerning. Was I right? Do you play too many video games? Yeah, I thought so. Alright, so like I said, this is a pretty quick test, so we really only have one or two more things to do. Now, this part is in our normal cranial nerve exams, but a lot of people don't mind this part anyway, so I'm going to do it anyway. I'm pretty much going to blind you with a light that's as hot as the sun and as bright as the sun, so you definitely don't want to look into it. But I'm going to tell you to, because that's my job. But, Okay, so my light is not working. Time to improvise this doctor roleplay video. Alright, so instead of following the light, what I'm going to have you do is look right here at the end of my pen. And just follow not the light, the end of the pen now. Just follow the end. Actually, this end will work better because it's a tip. Okay, just follow the pen. So far, your eyes are tracking perfectly fine. Alrighty. So, based on everything I've seen so far, you're definitely not in top shape. What I'm going to do, I'm just going to double check on that temperature because 104 is pretty high, so let's see if we can get a better reading. Maybe that's the problem, because based on the other tests, there should be no problem. So let's just make sure this is right. So stick out your tongue again, please. This time we'll wait about... You don't have anything to do today, right? Like 20, 30 minutes, right? Alright, sounds good. Alright, I'm just kidding, but if you want, I can throw on that TV or that radio over there if you want, so seems like it's going by faster. No, I'm just kidding. This should be enough. And alright, so we got a better rating this time. This time you're at 120 degrees Fahrenheit. I'm pretty sure that falls into a normal range. Yeah, there's no cause for concern there. You're pretty 120. It's still rising. It's still rising. 130. Yeah, you're good. You're perfect. So 130 degrees. That's normal. Your heart was beating fairly regularly, and the blood tests we'll get those back some other time. And same with the hair samples. And I checked your eyes. They were only a tad bloodshot, but we both know that's from video games, not from being sick. So in other words, I think you're perfectly healthy, and there's no reason for me to believe otherwise. So what I'm going to do, I'm going to give you your sticker. Oh, these are actually Band-Aids. I was supposed to put this on your flesh wound after I poked you for some blood, but I forgot to do that. Oh well, I'll just give you a sticker anyway. And there you go. Looks very good, looks very good. And remember how I told you I would like to check the healthy box? Well, based on your temperature and everything, I'm going to have to go ahead and check the, oh, what the heck. You seemed pretty healthy to me. There you go. One healthy patient. And, did you want any, medications? I can still give you a medication even if you're not sick. You just have to, tell me that you need some. You know what I'm saying? No, you're okay. You're gonna go to a different doctor. Ah, okay. Did I do something wrong? Ah, you think I diagnosed you incorrectly. Well, you can't win them all, I guess. So, I guess that concludes this session. Thank you very much for insulting my work. Have a good day. Hello, welcome to the eye clinic. Have you ever been here before? No? Okay. We're always open to new patients, so it's not a problem that you haven't been here. All that means is we're going to have to ask you a few more questions than we normally would, but besides that, everything will be the exact same. Now, are you just here for a standard ear or eye checkup? You're here for an eye checkup? Okay. That's simple enough. Pretty much. It's about 15 to 20 minute test just to make sure you are not in need of any contacts or glasses. So I guess I'm going to start with some questions. Can you just tell me your address, please? Okay. And what's your name? And the last name? And can you spell that for me, please? All right. And you said you haven't been here before, but when's the last time you had an eye appointment? About a year ago now? Okay, so you're definitely right on time. We normally do one of these about once a year, so that's good. And did you move? Is that why you're coming here for the first time? Okay. And who was your primary doctor before you moved? Okay, yep. I've actually worked with him a time or two. Very good guy. All right. Now, Did you come in because you had a concern about something you're feeling or seeing in your eye? Or are you just here because you know it's time for your checkup? You're just coming in for the checkup? Alright, so nothing concerning? That's very good. Alright, so I like to just start with the standard eye chart test. This is fairly common. I'm sure you've done it many times before. Okay, so what I'm going to have you do is look at each line, and I'm going to point at a letter, and I'm just going to have you tell me which letter that is. Okay? We'll start with the biggest line since I've never seen you before, so I don't really know how great your eyesight is. So, yep. Good. Very good. Next line, please. Very good. Alright, they're going to get a little smaller now. Good. Very good. Okay. Now, even smaller. Alright, your eyesight is pretty darn good, I'm gonna have to say. But normally we don't go much further than that, but since you're doing so well right now, I'm gonna see how far you can get. So, can you read this line? Very good. Alright, what about this one? Alright, you had a little bit of trouble on that line. So, I'm going to call it quits there, but I will tell you, you did very well on that test. Now, what I'm going to do, I'm going to put some gloves on, because I'm going to be doing a lot of stuff with my hands, and maybe even have to come up close and touch you a little bit, but I want to be sanitary, obviously. So, all right, my light didn't want to turn on, but what I'm going to do now is I'm just going to hold a light that looks like this outside of your vision, and I want you to just tell me when you first see the bright light enter your vision, okay? So just say now when the light hits your vision. Okay, let's begin. Good, good. Very good. Good. Yes, I know it's very bright, but it's a test we have to do. Very good. All right, just a couple more times, please. Alrighty, and one more time. Alright, very good. Now, what I'm going to do is come up very close and check out your eyes with my little magnifying instrument here. So, just take a deep breath. You can blink as comfortably as you would like. Alright, everything seems to look very good here. Yep. Alright, there's no problems with this eye. Now I'm going to do the same thing except without that tool. I'm just going to come in and I'm going to have you look in different directions. So just when I tell you to look up, down, left, or right, just do it, and I'm going to check the corners of your eyes. Alright, so just look up for me. Alright. Alright, now look down. Okay, yep. Look to the right, please. And now look to your left. Alrighty, so like I said, this test is very quick. We're already halfway done, so just relax. We're almost through this. Now what I'm going to do is I'm going to take my light again and I'm going to shine it directly into your eye, and I'm going to get up close and look deep into the back of your eye. What most people don't know is there's actually a little hole in the back of your eye that lets light in, just like a camera. So I just have to make sure that the hole looks very healthy in the back of your eye. So I'm just going to come up very close, and this is going to be a little bright, but I'm sorry. Let's see. Okay, yes. Alright, yeah, it all looks very, very good in there. Alright, now I'm going to check your other eye. Yep, there's no problems here. Very good. And now what I'm going to do is just kind of the same thing, except I'm going to quickly move it in and out of your vision to make sure that your eyes and your pupils are dilating correctly. So you're going to see a bright flash of light, and you can blink as many times as you want, but I'm just going to still get the same data from you. Okay? So just relax. Very good. Okay. Very good. Okay. Couple more times. Alright, so everything was good yet again. You only have one more test to pass before I can tell you you don't need any glasses or contacts, so that would be good news, obviously. So, what I'm going to have you do for this final test is just look at the end of my tool here and just follow it with your eyes as smoothly as you can, okay? So just look right at the tip. Just follow it with your eyes. So, told you it was going to be a very short, quick test. Everything looks very good. There is no cause for concern whatsoever. I will write you up for exactly a year from now to come back to this clinic. You don't have to go back to your primary doctor because I saw you here. Now, that doesn't mean you're obligated to come back to this one. But everything went very well, so have a good day. Hello and welcome back to my ASMR clinic. I know you've been here a couple times before, but no matter what your problem is today, I still need to go over all of the basic checkup of the eyes, nose, mouth, whatever it is. So, what's the problem this time? Why'd you come in today? Oh, I think you broke your thumb? Oh boy. And your pinky? Alright. Now how'd you do that? 2 separate occasions. Okay. The pinky? At a concert? Okay. I like to do that mosh pitting. I see. Okay, and the thumb? Yes, I see. So you were swatting a spider off your leg and you broke your thumb on your knee? It's a silly way to break your thumb, but well, let's check it out, I guess. Like I said, we're gonna have to go through the basic procedure just to get started, so I'm going to get on my gloves and we'll get started. These gloves are hard to get on sometimes. Just wash my hands so my hands are wet. Makes it even harder when they're not powdered gloves. Just bear with me. I'll be with you in just a moment. Okay, so we'll start with the eyes. It's very simple. You remember this. Just follow this pen with your eyes. No matter where this pen goes, just follow it, whether it's this way, up, down. Try to track it as best as you can. Look right here at the tip, if that's easier for you. They seem to be tracking as well as they should be. So, let me make sure they're dilating properly. This is going to be a bright light. Ready? I'm going to take less time to do this because you know the procedure by now. Good. Good. Very good. Okay, so your eyes seem to be in as good a shape as they're going to be. Now, this time I just want you to raise the hand. We're going to go to ears now. Raise the hand of what ear you hear the sound in. You know what I mean? If it's that ear, raise that hand. Okay? Alright, let's begin. Good. Good. Remember, both is an answer. Good. Very good. Okay, just a few more. Good. Very good. All right. So before I check inside your ears, well, actually, let's do that first. I'm gonna look inside your ears with the light and see if I need to clean them out or anything. I know this has nothing to do with a broken hand. It's just protocol. All right. Yes, this ear looks good. Not much wax, but there's a little we can get out. So I'll probably take some of that wax out. No, I'm gonna check the other one. Oh yeah, this one's a lot. There's a pretty good buildup in there. Yeah, this one's definitely in need of a cleaning, so let me go ahead and do that. Oh, I almost forgot. I should probably be typing in my results into my computer so I don't forget. Eyes were good. Still on ears. Alright. So, like I said, I'm gonna go through and clean your ears. They're in a little bit of a need of a cleaning. Just relax for me. Yeah, this one isn't too bad, but I've seen better. Alright, now for the other ear. Alright, so yours look good now. I guess let's move on to the mouth. Let me just get your information for your ears down. Good, so far so good. Now I'm going to have you open up your mouth as wide as you can and say, ah. I'm going to take a swab at the back of your throat. Your ears had a little bit of a redness to them, so I'm just making sure that you don't have some kind of cold coming on or strep throat or something like that that I can preemptively get rid of. So open up and say, ah. Very good. it's a little uncomfortable sometimes. Sorry about that. So I'll send this to lab and see if you got anything. Now we're about to get to the actual problem. Your pinky. And your throat swabs will be back soon. Okay. Now, you said this happened at a concert. How long ago did this happen? About 2 weeks ago? You really should have came in the first day. It didn't start to swell up for a while? Okay, I can understand that. Well, if there's any doubt, you have to come in and check because, as you know now, there might be further damage because you didn't come in right away. And if it really is broken, who knows? And you said your thumb might be broken too, from a different incident? The spider incident. Yes. Okay, so I'm going to very softly move your fingers that you tell me are bothering you around, and it might hurt a little bit, but it'll give us a better idea of your mobility with those fingers and whether or not it's actually broken. If I fear that it's actually broken, I'll have you step into the x-ray room, and it's going to cost you a little more, but we'll know for sure if they're broken. So just let me see your hand. Yeah, that hurts. Yeah, I thought so. I can see it's pretty swelled up. Now let me see your thumb. Yeah, that's pretty swollen too, but the pinky's definitely worse. I think we're gonna get x-rays on that pinky. The thumb does not concern me nearly as much. You don't feel as much pain either, right? Okay, so we're gonna do an x-ray for you. Just sit tight, I'll be right back. Now, what's gonna happen is the lights are gonna go off, and you're already prepped for x-ray. I know it doesn't look like it, but that's what this is. This is actually a new technology. You just stand in front of this. It's actually going to give you a whole body x-ray, and we'll just zoom in on your pinky and see if there's anything wrong. Alright, lights are going off now. There's one. This light switch doesn't seem to be working. Got it. There we go. Now you're going to see flashes of lights, okay? I just want you to put your hand directly up in front of you, okay? 3, 2, 1. Alright, now I'm going to get the other side. Put your hand up directly in front of you. 3, 2, 1. Alrighty. That should do it for the x-rays. They look, they're going to look pretty good. Now, just a couple more questions as I send this picture over with the computer to the lab. This has been consistently hurting, right? Has it been off and on, or has it been a pretty consistent thing? Pretty consistent. What about with the thumb? ibuprofen or any kind of medication, I guess I should say, to stop the inflammation, or are you just kind of letting it play out so far? You take a couple ibuprofen a day? How well do you sleep with the pain? Not well? Yeah, it's not looking good. We might have to stick you in a cast today. I'm sorry, but that's how it goes. Those concerts. Alright, so I'm receiving the message now from the lab. Let's see what we get back. Yes, he did circle one thing. The thumb is fine. Thumb is totally fine. That's good news because we actually ran out of thumb casts anyway, so you got lucky on that one. But the pinky, you have what we call a boxer's fracture. It's a break right above the knuckle, and it's a clean break. It's not like you broke your bone through your skin or anything. It's a fairly simple healing process. We just have to make sure that pinky stays still. So, what I've got for you is this cast. Now, how you use this is, since this is not shaped to your hand yet, you're going to open this up. Once you get it opened up, you're going to stick your hand inside where you think it'll be most comfortable. You're going to get your pinky and the ring finger in this slot here. You're going to use heat from a hair dryer, most likely, and this will get very warm and very flexible. You're going to bend this so it forms against your hand as good as possible, and then you wait for it to cool down, and you'll have a cast. To tighten the cast after it's all cooled down, just take this, crank it. I actually got in an accident recently too. My thumb hurts. Okay. Now as for pain, I don't think it's necessary with the amount of swelling you have to take ibuprofen anymore, so what I've got here is a couple of ice packs for you. Now, all you're going to do is squeeze together in the center where it says squeeze here. It's going to pop a fluid bag open on the inside, which will react to the beads at the bottom. That's going to cause it to be very, very cold. Now, I do not recommend, and I think it even says on the package, do not use for more than 20 minutes, and do not use on exposed skin. Wrap it in a paper towel, stick it on there for 20 minutes, and your inflammation should reduce a little bit. Now, same with the other one. This one's just a little older, so it's a little harder. A lot harder. Yep, so that's what I'm going to do for you. Now, the cast needs to remain on hopefully 24/7 for the next 6 to 8 weeks, although it could take up to 16 weeks to feel the full recovery, but 6 to 8 weeks should do it on the cast. You can take it off to shower, and I wouldn't take it off for bed because you don't know what you're doing in your sleep, but if you must, you can take it off for bed, maybe a couple times. Now, are you going to get in any more mosh pits, or can I let you go and expect not to see you back here in a couple weeks at least? Yeah, I know you'll be back in here. I'm trying to think if there's anything else I need to do before you go. I think that's about it. I hope you had a relaxing time here at the ASMR clinic, and I hope you come back to me next time you get injured. I know you will. You've been here many times. And have a good one. Hello. Welcome back. What is bringing you in today? You can't possibly be here for another cranial nerve exam. We just did one of those, didn't we? Oh, you recently had an accident? I see. So, you bumped your head pretty hard, got a concussion, and now this is a checkup to make sure everything's still good? Okay, well, I just do what you say, so I guess let's do another cranial nerve exam. So, first thing we're going to do is I'm going to put up both of my fingers, both of my hands rather, and you are just going to point to which set of fingers is wiggling like so. So, remember, just point at the hand that the fingers are moving on. Perfect. Very good. Good. Good again. Correct. Okay. Now, same thing, except I'm going to have you just cover that eye. So just make sure you can't see anything out of that eye, and same thing. It's going to be a little harder, but you should be able to get them all. Good. Very good. Perfect. Okay, so you had no problem with that test. That's a good start. Now, we're going to do things in order. I'll start with your eyes, then I'll move to your ears, then I'll go to your nose, and then your mouth. And if all is well, I can send you out of here, and you can go on with your life. And if not, I'll have to refer you to a specialist. We'll have to get a CAT scan done on your brain. But for right now, we're going to hope that doesn't happen, and move on to the next test. Okay, so for this test, yes, exactly. Yeah, you just did this, so you know everything that's going to happen already. There's actually, I think there's at least one new technique since you've been here last. But for right now, keep your head perfectly still. Just move your eyes and follow the tip of my pen, okay? Okay, very good. Now, we're going to do the same thing, but with the other end of my pen. You may ask why? Because this end of the pen is actually a light. So, what I'm going to have you do is just follow the light just like you followed the tip of the pen, except now this end, okay? Remember, keep your head very still. We only want to see your eyes moving. Okay, let's begin. So, the tracking in your eyes seems to be working just fine. And just like last time, I'm going to come in very close and check your pupil dilation, make sure it's all working. So this light is going to get very bright, but just try to focus on it as best as possible. Very good. Okay, good. Everything looks fine in that one. Now this one. Okay. Everything seems to be checking out perfectly. Alright, so we'll move on to the next test, which is, I think that's all we're going to do for eyes. Your eyes seem to be tracking and dilating and picking up my fingers very well. So we're going to move to the ears now. Now what I have here is a piece of cardboard, and I'm just going to be scratching it, tapping it, just making certain noises into your ears. And after we're done, you're going to tell me if you feel like you are hearing better in one ear than the other. But let's get started. Just try to stay very calm and very still. We only want you to focus on each ear's hearing. Okay, so did either ear sound more abrasive or more loud than the other ear? You think they were both about the same? Okay. Alright, that's very good news. Now, I'm going to do a similar thing, but with my hands. I'm going to put one hand up here by this ear, one hand up here by this ear, and I'm just going to in each ear. Now I just want you to tell me which ear it is that you hear the sound in. Let's begin. Okay. Very good. Good job. Very good. Now remember, both is an answer. I haven't pulled that one on you yet, but both is an answer. Very good. Good job. Good. Okay. So, your ears seem to be checking out. As you can see, I'm going a little bit faster than the last time we met. I'm doing this because obviously you were here just a few months ago, so everything seems to be working order so far, and it probably will still be that way. So, we'll move on to your nose or mouth. What do you want to do next? Nose, okay. This right here is just a normal cotton ball. What I'm going to do is I'm going to walk over there and I'm going to spray it with a certain fragrance. And I'm going to stick it up under your nose and you're going to tell me what that smell is. Okay? Okay, give me 1 second. I'm going to go spray 3 separate ones and you tell me which or what each one sounds like. What each one sounds like, what each one smells like, sorry. Okay, now remember, I know I said sounds like, but I mean smells like. So I'm just gonna hold this up to your nose, get a good smell, and tell me what it smells like. What was that? Orange, yep, oranges. Very good. Let me just grab the next one. Okay, here we go. Peppermint. Okay, yep. Good job. One more. This is a hard one. Here, let me spray a little more on. I don't even know what's in these bottles until after you take your guess, so we'll see what it is after. Really? You're right. They gave you a really hard one. Asparagus? That is a weird one. I've never had that one before. Well, either way, you did get it, so you have a better smeller than most, in my opinion. So, we'll move on to taste, and I hope you don't get anything too weird in the taste. Okay, so now what I've got is this little tablet. And I'm going to just place it on your tongue. So you're going to open wide, I'm going to place it on your tongue. This tablet is designed to have 3 different flavors, each one coming 10 seconds after the last one. So, after I put this in your mouth, you're going to tell me the first flavor. Then we're going to wait about 10 seconds, then you're going to tell me the second, then the third. Okay? Okay, stick your tongue out and open up wide. Blueberry, okay. Nothing yet? Okay. Strawberry. Okay, you got 2 good, easy ones so far. Let's see what the third one is. peppermint again? Okay. You got lucky with the taste. So, we've done all the stuff we normally do. We have a new technique that we're going to use on you this time, and then you should be on your way. It was a very quick test. So far, so good. One left to go. And this is what it is. I have a bunch of post-it notes here. They are all different colors, minus a few exceptions. There are a couple of doubles, as you can see, or hopefully you can see. Now, what I'm going to do is I'm going to hold up 2 of the colors. You're going to tell me if the colors are different, and then you're going to tell me each of the colors you're seeing if they are different, or the one color you're seeing if they are the same. Got it? Okay. So, first, tell me if they're different or the same. Yep, they're different. Now, can you tell me what color this is? Yep, green. And this color? Of course. Now, what about these 2 colors? Different again? Okay, good. And what color is this? Yellow. And this one? Blue, of course. Now what about these 2? Are you sure about that? What's this color? Green? Now what about this one? Oh, you see they're the same now? Yeah. Now tell me, are they the same or different now? Interesting. When they're together, you say they're different, but as I hold them up individually, you tell me they're both green. That isn't too much of a concern, but I will have to refer you to someone to check out your color blindness. Now, as I recall, you did not have color blindness the last time you came in here, so the bump on the head might have hurt your eye receptors or something. So I will refer you to a specialist when we're done here. Just a couple more with the colors. What about these 2? Blue and yellow. Good job. Okay, just one more. Different. Yep. And this one is blue. And this one, green. Okay. So I think that covered the whole spectrum of cranial nerve examination techniques, and you got everything correct except, of course, the 2 greens. So I'm going to have to refer you to a specialist. Okay, so I'm going to send you to the eye doctor. 2 greens, correct? 2 greens. And what did you see when they were both together? You said they were different. One of them was what color? Green still? Okay. And what was the other one? Yellow? Okay. Yeah, that is very odd. So you should definitely go to the eye doctor and get that checked out. But as for right now, my part's done. Cranial nerve exam over. Now, I have to ask you to try not to bump your head again, but if you do, of course, I'm always here. But if you don't, the next time I should have to see you is a year from now, exactly a year from today. I'll have the receptionist write it up once you get out there. Thank you very much for coming in, and have a good day. Hi, my name is Dr. Allen. I'm going to be giving you your eye exam and your ear cleaning today. Is that correct? Okay. Now, you requested this ear cleaning because you're having difficulty hearing? Okay, we'll see if we can take care of that for you today. And what about your eyes? Is that just because you're here anyway, or are you having trouble seeing? Nothing wrong with them, you just want to make sure? Okay, I can do that for you. So, first thing I'm going to do is I'm going to take a bunch of information from you. First, let me apologize. Obviously, I'm not in my normal doctor clothing. It's actually my first day. And I forgot them at home. Don't ask me how a doctor can forget his scrubs at home, but I did it, so I can't even believe they're allowing me to work in this. Oh well. So, the first question I'm going to ask is, how long has your ear been bothering you, or is it both? It's both ears? Is one hurting more than the other? This ear, the right ear, hurts a little bit more? Okay, I'll give special attention to that ear then. And how long has it been since your last checkup? $2 years? Holy moly. Now, I know all doctors say this, but you really need to get in here, I would say, at least once a year. If you go more than a year, anything can be wrong and you won't know it until damage is done, so you should probably come in a lot more often. That's probably why your ear hurts now. So you said 2 years since your last visit, and did you come here for that visit? You did? Okay. Do you know if you saw me? I know it was a long time ago. Okay, either way, I will be the doctor you'll be seeing today. How old are you? Is it weird that you're being seen by a doctor younger than you are? by quite a bit. I'm just teasing. So, do you have any insurance? You should get out of here with a very small copay, if any at all, so don't worry about that. Now, your eyesight. You don't notice any blurriness in either eye, one more than the other, or any at all? Alright, so what I'm going to do is I'm first going to look into your ears. I want to make sure that there's no wax buildup in there, because it could be a simple problem, as there's too much wax in there because they are not being cleaned enough since your last visit. That would be my best guess, but we won't know until I actually check. So let me put my clipboard down. Believe it or not, because it's my first day and I'm not very good at this kind of thing, I don't even know how I'm a doctor here. I also forgot my flashlight, but don't tell anybody. I'm going to use my cell phone as a flashlight to look inside your ears. This isn't going to hurt or anything. Okay, I'm going to move your ear just a bit, just so I can see deep inside and make sure everything looks alright. Oh yeah, I see. I definitely see some wax buildup. That could be the problem. It's also very red. I think you came in just in time. Okay. I'm gonna check the other side now. Oh yes. This one, you're right. The other one probably hurts a little bit more than this one. This one has no significant wax buildup, but we'll still give it a good cleaning just to make sure. Alright. Just give me a second to write this down. Since it's significant wax buildup, I am going to request that you allow me to clean your ears right now instead of waiting for more wax to build up. If you don't object to that, I will grab something and I will clean your ears now. That's okay with you? Okay, good. Just let me grab something to clean your ears. So, what I'm about to show you, remember it's my first day, I'm pretty sure is not a makeup brush, even though it might appear to be. It's actually very good for cleaning ears, so don't worry, it won't hurt at all. Trust me, it's not a makeup brush. It's definitely for cleaning ears. But I'm going to rub this in your ear now. It's going to feel a little strange, but it shouldn't be uncomfortable. Oh yes, it's actually working quite well already. I'm sorry if this is too loud for you. I really have to dig deep to get all this wax. Just about 10 more seconds now and I'll be done. So that ear should stop causing you as much trouble. I still want you to follow up quicker than 2 years next time, just to make sure no more wax builds up. I'm going to check the other ear now. This one should not take too much effort to get all the wax out, as it looks way better than the other one. Okay? Oh yes, this one is significantly better. Now, that leads me to believe there may be a mild ear infection in your other ear. And if that's the case, I'm going to have to prescribe you something at the end of this session. Don't worry, it won't cost too much. You have very good insurance. That's what it's for, right? Okay, so I'm done brushing this ear. Well, cleaning it rather. So I'm going to mark down that I cleaned your ears. I'm going to mark down that you're going to need a prescription. Some mild antibiotic should do the trick for that ear. Now, just to test out that that worked and you can hear better, I'm going to see how well you can hear. Now what I'm going to do is I'm going to click like this. Every time I make that click, I want you to say now, so I know that you heard the click. I'm going to get up close and make the click into your ears. Yep, good, good. Good, good. Good. How many times did I click? 4, yes. Alright, so it seems like that ear's good. Now I'm going to try the other ear. Tell me how many times I click this time. Yep, of course. Yep, again. One more time. Yep, 4 times. Good job. So your ears seem to be a lot better than they were when you first came in. Based on what you're telling me, it's about, you can hear about double. Is that correct? Okay, good. So let me write down that my makeup brush is a good instrument to be cleaning ears with, even though if I got caught doing that, yeah, it's definitely a makeup brush now that I relook. But as long as it didn't hurt you and it did the trick, oh well, right? One of the nurses really likes elephants here. They're littered all over this. Yeah, you saw them? Yeah. She's kind of crazy. Okay, that brings us to the second part of our exam, and that's your eyes. Now I do have a series of tests for your eyes as well as I did for your ears, and the first one is going to be Very simple. I'm sure you've done this before. Although it might have been a long time ago based on how often you come in. I'm just going to have you follow my finger with your eyes. Try not to stutter at all. Just follow my finger nice and smoothly. I want to make sure your eyes can track everything that moves well. Alright, I'm going to add the other finger. Gotcha. Yeah, I know some of those were kind of impossible. Sorry for my inexperience. Like, I don't know how you're going to be able to do this. But, you know, you didn't do a bad job, so whatever. Now I'm going to do the same test except with my trusty flashlight. So I just want you to follow the light with your eyes. You're doing very well. Your eyes don't seem to be in any kind of distress. They seem as healthy as they could be. I'm just gonna call your eyes good. I don't see anything wrong with them. There was nothing wrong with tracking, and your pupils dilated correctly in the light. So I'm going to say that everything's all right. Okay, I'm just going to write down some last information. Okay. When is the next time that you plan on coming in? And don't say 2 years from now. By then I'll be experienced and I will be very upset as your doctor that you didn't come back for an exam. Okay. I'll put you down for 6 months, so 6 months to the day. That brings it to January 6th. January 6th? I know that's a long way ahead, but that doesn't ring a bell as a day you can't do anything. Okay, well, then January 6th it is. Now for the prescription. I'm going to... Since your ear already shows improvement, I know that the infection is very mild. I will give you a very, very light antibiotic, and you need to take it once a day for as long as the problem persists. As long as you feel pain in your ear, you're going to take one of those pills per day. If for any reason you run out, there's 30 of them, so you should get a month. If for any reason you do run out, I can refill you one time. And if it's still persisting, we're going to have to up the dosage or find you a new medicine, because it's obviously not working. do like the sound of it when I write. I hate it when you get paper with the frillies on it. Do you know what I mean by the frillies? The pieces that have this. I'm just gonna rip this off real quick before I send it through the copier. Now I hope that wasn't too abrasive on your ears. Is there anything else you wanted me to check before you go? No, not that you can think of. I'm trying to think of anything I can do for you to make your recovery a little bit better and a little bit quicker. Maybe what I'll do, I will just go back over with the brush. This time I will brush a little harder, and I will try my best to get all the wax out. That should make you more comfortable, and I can tell that you really enjoy the sound of the brush. See, it's my first day and I don't even have to look at what I'm doing. I think I'm going to be a good doctor if I remember to bring my equipment next time. I can tell that you really like the sound of the brush, meaning I've got to ask, are you one of those ASMR watchers? If you are one of the ASMR watchers, I will say I have dipped in a little bit to the ASMR community, and they really do a good job of relaxing, and they really do a good job at it. Sometimes when I have trouble falling asleep, it's perfect. It's perfect to just stick some earplugs in and earbuds in and just go to sleep to it. I can tell you're one of those people, aren't you? I'm straying from the doctor topic. I don't know why. I don't know. I think it's because you're my first patient. I really just wanted to make a bond with my first couple patients. So, yeah, I hope this experience went well for you. I'm going to give you a survey. They need to make sure that I am fit for the job. I would really appreciate it if you didn't put the fact that I forgot my flashlight, even my clothes. Yeah, I'm not going to be a very good doctor. Alright, well, it was nice to meet you, and I will see you back here in 6 months. That's if I'm still here. Thank you very much. Oh, hi. I remember you. You came in about 2 weeks ago for an eye examination. Is that correct, or am I mixing you up? Yeah, you came in for the eye examination, and I'm pretty sure you and I agreed upon an ear examination next, right? Yeah? Okay. And I take it that's why you're here today? Alright, very good. So, since I already know a lot about you in the information sense, I don't really have to ask you too many questions, but as a preliminary question, I have to ask, do you have any pain in either of your ears? Yes? Okay. Well, that's definitely a good thing that you actually came in then. And do you think that this pain is causing you any hearing problems or any loss in hearing? It might be? Okay. So, based on that, we're not going to do a standard test where I just test you and say you're good and then you can go on your way. In this case, we're going to make sure that your ears look fine. And if they don't, we're going to do a series of tests and then clean your ears or try to fix whatever's wrong with your ear. And then we're going to retest those same things. And if you show improvement, then we know that your ears just needed a simple cleaning and there's nothing more serious. But if you don't show improvement, well, we're going to have to give you some kind of medication. But for right now, we're going to figure out what's wrong with you. So the first thing we're going to do is, obviously, I'm going to look inside your ears. So just stay very still. Oh yeah, okay. Alright, yeah, it's definitely full. I'm not seeing any immediate cause for concern, so that's good. But, yeah, it's definitely got a lot of buildup in there, so let me see the other ear. Oh yeah, same thing already, I can tell over here. Yep, it's not red, and it doesn't look infected right away, so that gives us a clue to what's wrong with you. Alright. So, based on what I saw in there is a lot of buildup in both ears. And you said both ears were giving you a problem? Yes, okay. And the buildup is a sign to me that, well, the buildup with no redness kind of means your problem probably is just your ear's too full of wax. So what we're going to do is we're going to test you before, like I said, and then I'm going to clean your ears, and then we're going to test you after. And I would assume that fixes the problem. Unless there's something deeper going on, which when we get there, we'll get there. But for right now, we're going to start with the standard tests. For this first test, I'm going to come up close to you, and I'm going to whisper 3 numbers into your ear. And then I'm going to have you repeat back those 3 numbers for me. And hopefully you can get them all right. So, here's the first 3. 1, 3, 5. Yep. 7, 17, 700. Of course, very good. 9, 9, 9. Very good. Okay. Just one more for this here. 1, 9, 11. Yep, very good. So, I'm going to do the same thing on this ear now. 7, 6, 5. Very good. 4, 7, 5. Good, good. 6, 17, 8. Good, good. Okay, so you aced that part. That's a good sign right off the bat. You're not having any trouble distinguishing numbers, so that's a pretty good sign. Now, what I'm going to do is I'm going to put some gloves on. And I'm going to go up to each one of your ears, and I'm just going to rub in one or the other ear. And when I do that, I'm just going to have you tell me which ear you hear the sound in. So, let me just get my gloves on. Alrighty. So, like I said, I'm just gonna make a noise like this in either one of your ears, and you just tell me which ear it is. Okay, let's get started. Very good. And I should tell you that both is an answer, so keep that in mind. I can do both. Very good. Was that a little bit more difficult for you? Okay. That shows me that that ear might actually be more of a problem than the other ear. But let's continue with the test. Okay, you got that one. Both, yep. Yep, very good. Alright, very good. So, for that test, you did have that one little mishap, so I'm going to, obviously, after we clean your ears, make sure it gets better. But for right now, let's continue. So what I've got here is none other than a clipboard. And what I'm going to do is I'm going to hold it up to the front of your face, and what you're going to tell me is if I scratch it or if I tap like so. Alrighty, so let's get started. Remember, tap or scratch. Scratch, yep. Yep, tap, very good. Yep, scratch again. Very good. Yep. Very good. Alright, I'll give you one more. Yep, okay. So you did ace that test. Now, this is the part where I'm going to actually go inside your ears. I know that you're not supposed to clean your ears yourself with a Q-tip, but as a doctor, I'm certified to clean your ears properly. So I'm just going to take this Q-tip and I'm going to clean both your ears. And after I'm done, I'll retest you. Now, when I touch your ear, nothing hurts, right? Almost done with this ear. Okay, so there was a lot of wax on that ear, so I'm going to grab a different Q-tip. And now I'm going to proceed with the other ear. Yeah, just like the other one, this one's pretty filled. This one might actually be a little worse. You need to start coming in a little bit more often because those ears were filthy. But now I'm going to go through the same tests that we already did, and this time there should be no mess ups. And if there is, that indicates to me that you probably have an infection and we're going to have to give you antibiotics for it. But as for right now, just concentrate as hard as you can and try not to mess up at all. Okay, back to the numbers. Just repeat them back to me. 1, 2, 3, 7. Good. And this time I'm going to alternate ears. 6, 7, 6, 42. Very good. 1, 1, 1. Good, good. 8, 9, 10. 100. 7, Okay, and just give me one more set. 5, 4, 72. Alright, very good. That time you aced it. Well, actually, as I recall, you aced it the first time. But this is the part that you had a little bit of trouble with last time, so like last time, I'm just going to make the sound in one of your ears, and you just have to tell me which ear it is. Alright, let's get started. Yep. Very good. Good job. Good. Yep. Good. Alright, so based on that shows me that cleaning your ears not only improved the ear you were having trouble with last time, but also the other ear. So at this point, it's looking good. It looks like I'm not going to have to give you any medicine, but we still have one more test to do. Just let me take off the gloves. I don't need it for this part. These gloves, they just don't come off. That's why I like the powdered gloves. But those make a mess. Alright, so I only have one more test until you're home free. Now, I'm going to hold it up to you again. And you're just going to tell me if I'm scratching it or tapping it. Very good. Good. Good, good. And one more. Good. So, based on everything I tested today, all I gotta say is you need to come in here a little bit more often to get your ears cleaned. Never do it yourself with a Q-tip. That's how you can really injure yourself, and we're gonna have a bigger problem next time. So, I would say, like, how often do you come in now to do it? Once a year. Your ears obviously get dirty quick. So, I'm going to say once every 6 months should do it. So, I'll make an appointment for you in 6 months. And I hope everything went well for you. And I hope you have no more problems in your ears. And if for any reason you do have any more problems in your ears, just come right back and I'll take care of you again. Thank you very much for stopping in. And have a good day.